Has your newborn been making snoring or snuffling sounds while sleeping? It can be alarming for new parents, but it's important to know if these noises are just a typical part of being a baby or a sign of a breathing issue. First, take a deep breath yourself. In the vast majority of cases, these sounds are completely normal. They are simply a result of newborns having very small nasal passages. To understand why, look at the anatomy. Newborns are primarily nose breathers with tiny airways. Because their passages are so narrow, even a small amount of mucus can cause noisy breathing. It is a common myth that all snoring is dangerous. In reality, occasional snuffling is very common. You only need to consider a medical evaluation if the symptoms are persistent or severe. What causes these noises? It could be mild congestion from environmental factors, dry air, lingering milk residue after a feeding, or even just the physical angle of your baby while resting. How do you evaluate if it's a concern? Generally, there is no need to worry if the baby is feeding well and sleeping comfortably. However, consult your doctor if you notice persistent loud snoring, breathing pauses, or color changes. Be vigilant for signs of respiratory distress. Specifically, watch for your baby's chest pulling inward around the ribs or neck, or a bluish tint around the lips, which may signal a lack of oxygen. To help with a stuffy nose, you might consider using saline drops if recommended by your pediatrician, gentle nasal suction, or a humidifier. Always keep your baby in a safe sleep position. The golden rule of safe sleep remains the same regardless of breathing noises. Always place your baby flat on their back and ensure the crib is kept clear of props, pillows, and loose bedding. To summarize, tiny noses often make louder sounds, and occasional snoring is usually normal. Stay observant, and if you have concerns about your baby's breathing or feeding, reach out to your healthcare provider.